How to cure sciatica, home remedies. Hello and welcome to another video. If you're new to this channel, Health and Remedies, it mainly covers health conditions and their treatments, complementary medicine and nutrition. So if this is of interest to you, please subscribe and you'll get lots of free, interesting and informative content. Have you ever wondered how to reduce your pain from sciatica? Have you questioned whether there are any effective home remedies to ease the pain? You're in the right place, as this video covers 7 home treatments for sciatica, so stay tuned till the end. Now let's get into it. Number 1. Posture. Try to maintain correct posture when sitting and avoid sitting for a long time. Be sure to sit straight, but also take regular breaks from sitting to prevent spinal strain. If you stay in the same position for too long, the pain from sciatica may worsen. Try to change your posture every 20 minutes. Number 2. Exercise. Regular exercise can help to reduce sciatica pain. Include exercises that strengthen the core, as this will support the spine. Short walks can reduce inflammation, which in turn alleviates sciatica. However, it's important to consult with your physical therapist to ensure your form is correct to prevent further injuries. Although it may be tempting to avoid exercise when in pain, research shows that too much rest can trigger sciatica pain in your back and legs. Therefore, it is important to regularly include simple exercises such as a walk, which will strengthen the spine and prevent further damage. Any exercise should be done with care. Be sure to use good posture and be gentle so as not to strain the muscles and worsen the sciatica. Another helpful exercise is the plank. Lie face down on the floor. Keeping the body in a straight line, then lift onto your forearms and toes, keeping the elbows directly underneath the shoulders. Hold for as long as possible. This is also a good core strengthening exercise. Number 3. Applying heat or ice packs. Applying ice or warmth to the painful areas can reduce inflammation. Applying ice for 15 minutes can numb the area, while applying heat packs will increase blood flow and promote healing. Both can reduce muscle spasms, which are also common in people with sciatica. A good guide is to apply an ice pack for 15 minutes every hour and then apply heat for 15 to 20 minutes every 2 or 3 hours. Use like a towel to protect your skin when applying both, and do not sleep while applying heat or ice. Heating pads are compact and travel well and can be transported to work. Alternatively, warm baths are effective for relieving joint pain and relaxing the muscles. Number 4. Massage. Massage relieves pain by reducing pressure on the sciatic nerve. An effective form of massage is trigger point therapy, which relaxes the muscles near the sciatic nerve and which puts pressure on the nerve. A qualified remedial massage therapist is likely able to provide this type of massage. A deep tissue massage may also help. Number 5. Complementary therapies. One effective example of complementary therapies includes the Alexander technique, which helps release excess muscle tension and in turn sit, stand and move with more comfort. The Alexander technique can also prevent flare-ups by improving posture, promoting correct body movement. The Alexander technique helps with improving the mind-body connection. An instructor of the Alexander technique will guide you on the various body parts while you are sitting, standing, walking, or lying on a table. It can be difficult and time-consuming to change old bad habits regarding posture, so applying the Alexander technique takes time and repetitious practice. Regardless, unlearning old habits of movement and learning new ones takes time and repetition. It can take 10 to 30 Alexander lessons to achieve long-term change, and some people continue lessons thereafter to maintain and improve their posture. Another effective form of complementary treatment is acupuncture, a traditional Chinese practice that releases the body's natural energy, improves blood flow and oxygen. It is FDA approved to treat sciatica. An acupuncturist inserts fine needles into the skin in specific areas. However, there have been mixed results with acupuncture to relieve sciatica. Be sure to choose an accredited practitioner with lots of training. Yoga is another complementary treatment which can help. Certain yoga stretches can reduce pain. Yoga stretches that lengthen the spine and improve posture can reduce stiffness, inflammation, and pain. Yoga is safe and effective for sciatica. It can also strengthen the core, relax stiff areas, and help prevent further pain. A common but effective yoga posture is the pigeon pose, which opens the hips. There are multiple versions of this stretch. If you have just commenced treatment for sciatica, it is best to start with the reclining pose. Lying on your back, raise your right leg up to a right angle. Clasp both hands behind the thigh. Lift your left leg and place the left ankle on top of the right knee. Holding this pose will stretch the muscles which can become inflamed and press against the sciatic nerve, causing pain. Repeat this pose with the other leg. Once you have achieved this pose without pain, work your way up to the sitting and forward versions of pigeon pose, working with your physical therapist. The sitting pigeon pose involves sitting on the floor with your legs outstretched. Bend the right leg, putting your right ankle on top of the left knee. Lean forward, allowing the upper body to reach towards the thigh. Hold for 15 to 30 seconds. This will stretch the glutes and lower back. Repeat on the other side. Another effective yoga pose is the knee to chest stretch. Lie on your back with a cushion beneath your head, bend the knees and keep the feet flat on the floor, hip width apart. Bend one knee toward the chest, holding it with both hands, and hold for 20 to 30 seconds. Repeat on the other side. Repeat twice on each side. Another pose is the forward pigeon. Kneel on all fours. Pick up your right leg and move it forward on the ground. Keep the lower leg on the ground horizontal to the body. Place the right foot in front of the left knee while the right knee stays to the right. Stretch the left leg behind you on the floor with the top of the foot on the ground and toes pointing back. Shift the body weight gradually from arms to legs so the legs support your weight. Sit up straight with your hands either side of your legs. Take a deep breath. While exhaling, lean forward over the front leg, supporting your weight with your arms. Repeat on the other side. Number 6, back exercises. If your back or legs hurt, it may feel natural to want to rest, but engaging in gentle exercises that strengthen the back are effective for reducing sciatica symptoms. Examples include water aerobics and stationary biking. The stronger the back muscles, the better it will support the spine and relieve pressure on spinal nerves, which can reduce sciatica pain. Number 7, stretching. An effective stretch is the sitting spinal stretch, which creates space in the spine, relieving pressure. Standing hamstring stretch eases pain and tightness in the hamstring. Gentle stretches daily will improve spinal flexibility and range of motion, and also building core and spinal strength. A simple but effective stretch is knee to opposite shoulder, which reduces sciatica pain by loosening the gluteal and piriformis muscles, which can become inflamed and press against the sciatic nerve. Lie on your back, extending the legs, and point your toes upwards. Bend your right leg and hold the knee. Pull the right leg across the body towards the left shoulder, holding it for 30 seconds. Only pull the knee as far as it will comfortably go. This should not be painful. Return the leg to its starting position. Repeat 3 times, then swap legs. Another effective stretch for sciatica is an easy hamstring stretch. Lie on your back, lift one leg in the air, wrap a towel or strap around the raised thigh or foot, and support your leg with the strap while straightening your knee. The leg on the floor can be bent or straight. You will feel a stretch on the back of your leg. Alternatively, sit on the edge of a chair with both feet on the floor. Extend one leg and flex the foot, so the weight of the leg is resting on the heel. Keep the back straight, rock forward on the sit bones. You will feel a stretch on the back of your leg. Remember, with all stretches, stretch only until you feel a slight tension, but not discomfort. Stretch with the intention to feel better rather than becoming more flexible or increasing your range of motion. Eventually, your flexibility and range of motion will improve, but gradually so, with regular practice. Stretching too hard can lead to torn muscles, tendons and ligaments, which will result in pain and less flexibility. If you feel pain, be sure to stop stretching immediately. You could pull the knees to your chest or perform a seated hip stretch or seated spinal twist to relax the buttocks, hamstrings and calves, all of which can exert pressure on the sciatic nerve. Sciatica pain is increased when the vertebrae is compressed. In order to create space in the spine and therefore relieve pressure on the sciatic nerve, the following stretch will help. Sit on the ground with the legs extended straight and the feet pointed upwards. Bend the right knee and place your foot flat on the floor on the outside of the opposite knee. Put the left elbow on the outside of the right knee to help turn the body toward the right. Hold for 30 seconds and repeat 3 times, then switch sides. A stretch which eases pain and tightness in the hamstring due to sciatica is the standing hamstring stretch. Place the right foot on an elevated surface at or below your hip level. This can be on a chair or step. Flex the foot so the toes and leg are straight. If the knees hyperextend, keep them slightly bent. Bend the body forward towards your foot. The further you bend, the deeper the stretch, but don't bend so far that it's painful. Release the hip of the raised leg downwards. If this is difficult, place a yoga strap or exercise band over the right thigh and under the left foot. Hold for at least 30 seconds, then repeat on the other side. Another effective stretch is called the sciatic nerve mobilization. Lie on the back with a cushion beneath the head. Bend the knees, place the feet flat on the floor, hip width apart. Bend one knee towards the chest, holding the back of the knee with both hands. Straighten the leg up. If you experience sciatic pain, stop trying to straighten the leg any further. Hold for 5 to 10 seconds and swap sides. Repeat 10 to 20 times on each side. Final tips that may help include placing a small, firm pillow between the knees when lying or sleeping on the side or back. If after trying the above-mentioned home therapies your sciatica pain is not improving, it may be worth seeing your personal doctor or spine specialist. If you experience the following symptoms, it is important you see your doctor as soon as possible. Severe pain in the lower back and legs, weakness, numbness, tingling or pain similar to electric shocks, pain that does not subside after 2 weeks, worsening of pain and symptoms after using home therapies, or loss of bowel and or bladder control. On the other hand, simple home treatments like gentle exercise, ice and heat therapy, proper posture and medication may help a lot to improve your recovery. But always remember to call your doctor if your pain is worsening and home treatments are not helping. Thank you so much for watching this video. If you enjoy this content, don't forget to hit the like button, subscribe to the channel and hit the notification bell for more informative videos on health conditions and their treatments, natural remedies and nutrition. Also, feel free to leave a comment. Have you suffered with sciatica? Have you tried any of the above-mentioned treatments? I would love to know what has worked for you. I look forward to sharing another video with you soon. Bye for now.